It is believed that 80% of Americans will deal with back pain during their life, but you don't necessarily have to start at the doctor's office. You can actually start right here at Rehab Associates of Central Virginia. I talked to Dr. Brian Britt all about it.
When we talk about lower back pain, we can think of it in two broad categories. There's specific lower back pain, and those are things that are caused by I've had a fracture or a tumor, or I have arthritis, or I have a disease such as ankylosing spondylitis. These are things that we can point to and say that's what's causing your back pain. As a matter of fact, with back pain, only 10% account for specific lower back pain. The rest, 90%, are what we call non-specific lower back pain.
And let's talk about that 90% then how do you treat them? And I know for sure that back pain can be debilitating, so you really need to take care of it.
Yeah. So the first step in physical therapy, since the mid-90s, physical therapy has been using what's called treatment-based algorithms to be able to classify back pain. Again, not all back pain is the same type of back pain. Your physical therapist should be able to look at your back pain and classify it and know what are the logical next steps or first steps to be able to treat that back pain to help you decrease your pain, improve your flexibility, increase your function while progressing you towards your goals.
And the sooner you treat, the better, right?
Yes, ma'am. Probably the best prognostic factor, again, things that we look at that improve your chances for good recovery are getting in to see your physical therapist sooner.
And let's talk more about that with Diane specifically.
Yes.
She hurt her back while lifting, and she's really made great strides because she was in the ER at one point.
Yes, and it's not uncommon. This is pain which is unlike anything you've ever seen. You think, oh my gosh, something needed to happen. But again, getting in there early can get you a very much so quicker recovery on that.
And of course, we all want to not have back pain and not even get to that point. What are some good ways to make sure we're not getting to that point?
Again, the best ways are just make sure that you're keeping healthy, you're exercising regularly, you're keeping moving. Try to avoid smoking. If you're sitting a lot for a job, make sure you're getting up regularly to take breaks. And when you're sitting, make sure that your posture is appropriate and you're in a good position on that. Another thing, a lot of people end up injuring their back during lifting. Try to avoid lifting. They always say, lift with your knees, not with your back. And it's easier said than done sometimes, but really make sure that when you're lifting, you're not lifting with your back. You're also not carrying something while lifting and twisting while you're doing that.
And the great thing about going to rehab too is you don't necessarily have to go to your doctor first. Tell me more about that.
Yeah. So last time I was here on Living the Heart, Virginia, I did talk about direct access laws for physical therapy. Now these cover non-federal payers. Non-federal payers would be anybody who has private health insurance. Unfortunately, it does exclude Medicare, TRICARE, and Medicaid programs. But you can come and see a physical therapist directly. So say you had back pain, you could come in and see us as soon as you have that back pain and get treatment sooner, which improves your chances of recovery.
And say I came in here for back pain, but then you figured out it was a medical issue, then you could send me forward, right?
Yes. Physical therapists probably for the last 20 years have been a doctorate level profession that allows us to differentially diagnose conditions. So say if I saw a patient who wasn't appropriate for physical therapy, or they needed to be sent to somebody else, another provider or a referral to another source, we should be able to recognize those and refer appropriately.
And the whole point is living your best life, right? And
Yes,
keep
ma'am.
on moving, and it's never too late to try to build up that strength in the body.
Yes, ma'am. And again, it's all about successful aging and making sure that you can do as many things as you want to be able to for as long as you can be able to.
Wonderful. And if you're experiencing back pain or any kind of pain, give the folks at Rehab Associates of Central Virginia a call at 855-RACV-4PT or check out their website at racva.com. They have many area locations to serve you.